This is Team 3 Cats and a Turtle with the Drug Overdose video. My name is Jenny and I will be the hygienist today.
My name is Danny and I will be playing the patient.
My name is Nicole. I will be the narrator and the bringer of the things.
My name is Precious and I'll be Dr. Taylor.
Danny is a 30-year-old female who is coming into the dentist for her second cleaning of the year. Danny is a relatively healthy patient who suffers from dental anxiety, classifying her as an ASA level 2 patient. She has been self-medicating with Percocet as needed for pain after a severe car crash she was recently in.
Thanks for coming in today, Danny. After looking through your medical history, I can see there's been a change in your medication since we saw you last. Can you tell me why you're taking Percocet?
I was in a severe car crash a few months ago and was hit by a semi, weighed like 30 tons, and it was at like 50 miles an hour. Some of my ribs were fractured and I still have a pretty intense concussion.
Oh, I'm so sorry to hear that, but I'm glad to see you're feeling okay. So how often are you taking the Percocet and at what dosage?
I take it as needed, but the pain was really bad today. So I took a couple in the morning. There was 7.5 milligrams. I was super nervous about coming here, so I did take one Xanax in the parking lot too.
Okay, let me add that. And so how many is a couple? Do you know the exact amount?
I'm pretty sure it was 2.
Okay, so let's start take your vitals. I can see that your BP is 85/50. You're a tad on the low end. I want to see what your heart rate and your respiration rate is looking like.
I think it's always a little low. Is it bad?
I see that you're at 11 respirations per minute and your pulse is feeling a tad bit weaker than I typically like to see, around 50, or you're around 50 beats per minute. Are you sure it was just the 2 Percocet and 1 Xanax that you took today?
It's 2. Maybe more in the parking lot. Maybe a lot of Xanax.
Danny, can you hear me? Dr. Taylor, can you come in here stat? Nicole, can you bring the emergency kit, AED, oxygen, and can you call EMS for me?
I called 911. Here's the AED, the oxygen, and the medical emergency kit.
Jenny, you called for me. What can I help you with?
I have Danny here today for a prophy, and I was going over her vitals, and she started slurring her words. Her vitals are extremely low. Her skin is now pale, cold, and clammy, and I believe she may be overdosing on Percocet and Xanax. She took 2 7.5 milligrams of Percocet and 1 Xanax, and admitted to me right before she lost consciousness that she possibly took a little bit more than that.
All right, it's pretty clear that this patient is having some confusion and she seems to be quite unresponsive. The procedure today should be terminated. Let's get her in a supine position and monitor vitals until EMS arrives. Can I get the oxygen, please?
EMS arrives and the doctor gives them details on the condition of the patient.
EMS is here. What's the situation?
Thanks for coming in, guys. This is our patient, Danny. She's a 30-year-old female who is classified as ASA2, and there is a possible overdose of Percocet and Xanax. Her vitals are low and seem to be dropping quickly. Last reading was 65/40. Respirations were 6 per minute. Her heart rate dropped to 37 beats per minute from 50 beats per minute in the last 6 minutes.
Okay, thanks. We'll take it from here.
EMS will now transport this patient to the hospital for further monitoring, and the patient will be educated on the effects of mixing pills. This patient took both an opioid and a benzodiazepine in large doses before her dental appointment. These medications are both considered to be CNS depressants, and the patient should consult a physician before mixing them. While they can be taken together, they should be taken at lower doses to prevent an overdose.